Please welcome Ronald J. Daniels, President of Johns Hopkins University.
Good morning. Well, there's no denying for those of us who inhabit institutions that are proudly based on foundational commitments to things like the power of data, of science, of expertise, the current moment is, dare I say, fraught. We, not without justification, feel caught in a set of tectonic societal shifts that have cast doubt on the legitimacy of our core enterprise. And while we certainly can't succumb to the belief that we are entirely without any responsibility for some aspects of our current moment, the criticisms leveled against us lack nuance. They are disproportionate, and they are irresponsible. And I truly fear, that they will lead to consequences that will inflict grave costs on our country's vaunted strengths in evidence-based research and public health practice. How's that for a really inspiring talk to a room full of optimistic practitioners of public health? But bear with me, this does in fact get better. Because what for me is fortifying in this moment and bears, I think, repeating at this convening, is that this initiative is even more poignant today than it was 8 years ago when it was first established by Mike Bloomberg. At that time, as he mentioned earlier, Mike was alarmed by the growing evidence that life expectancy was declining both in relative and in absolute terms in the world's most prosperous country. More than that, these global trends mask deep and wrenching disparities in life expectancy between those with and without college education, a set of disparities that knows no geographic bounds and has grown only more politically salient over the years. A set of disparities which has had such a profound and destructive impact on our nation's politics and our cohesion. And so the focus that you have all trained on the major contributors to those corrosive and persistent disparities, addiction, gun violence, food insecurity and obesity, adolescent health and environmental degradation, remains relevant and urgent. If the core public health priorities embraced by the Bloomberg American Health Initiative continue to be pertinent, so too is the way in which the program has systematically drawn upon lived experience and battle-tested perspectives of public health practitioners who hail from communities across the country. We know and we acknowledge that science alone doesn't always, if ever, dictate a straight line to a single policy intervention. Choice, discretion, and judgment, informed by local knowledge, felt need, and existing institutional arrangements, local culture, are all required in determining how best to respond to a concrete public health challenge. And it's through the steadily growing network of the graduates of the Bloomberg American Health Initiative program, all the fellows who are here, these folks who have mastered the science and the art of public health practice and policymaking, that we're able to interrogate what works and doesn't work and refine our interventions accordingly. And despite the rancorous acrimony that has truly deformed our national politics, the quiet, the focused, broad-based work of our graduates taking place in literally hundreds of local communities across our country shows the promise of public health to develop humane and innovative solutions to address felt need and improve the human condition. Public health is not now and never has been a flyover work. It is instead the work of and with the community, whether introducing low-cost test strips to stem the surge of fentanyl, equipping state leaders with data-driven practices to halt the tide of climate crisis, or expanding access to healthier food options in communities long denied basic sustenance. And so, while I acknowledge the seriousness of our moment, we cannot lose sight of how right and important the work that you do is, the impact that it has, and the optimism that it imparts. I don't want to be naive and suggest that there's no peril from the decisions that are being made today and will be made in the months to come, including about how and whether science, expertise, and data will continue to fuel this country's dazzling success. But what won't change is the fact that the project we dedicated ourselves to nearly a decade ago continues to be right and relevant to our times, and I think will help provide a guiding light that shows us a path forward. Your work is really, really consequential. It is inspiring. We're so enormously proud of you and the work that you're doing. So thank you for doubling and redoubling your commitment to this important work, to this important enterprise. With that said, it's my great pleasure to introduce our next speaker. A devoted public servant, Javier Becerra understands the powerful intersection of law, policy, and public health from his early days as a legal advocate for people with mental illness. Secretary Becerra has spent his career ensuring all Americans can access affordable, high-quality health care. As California's Attorney General and 12-term congressperson, he championed the Affordable Care Act, fought for greater patient safety, expanded access to Medicare and Medicaid, and established key safeguards to ensure the health of frontline workers during the pandemic. Today, he is the 25th Secretary of Health and Human Services and holds the distinction of being the first Latino to occupy that office in the history of our nation. Please join me in welcoming to the stage Secretary Javier Becerra. Thank you.